Hello, my name is Michelle Villalon.
My name is Camila Llanes.
And my name is David Barado. So, what are anabolic steroids?
Imagine you're in your school's gym and you notice some students who seem to be getting significantly stronger and more muscular in just a few weeks. What's their secret? Are they using something extra to boost their performance? Could it be steroids?
Steroids are a broad category of molecules with similar structures and various functions. Steroids are classified as lipids even though their structural makeup differs from that of other lipids due to their hydrophobicity and solubility in water. Their structure differs from that of ordinary lipids because they lack fatty acids, which are strong hydrocarbon chains with a carboxyl group at one end. Since most steroids are alcohols, they are also referred to as steroids. When people mention steroids in sports, they usually refer to anabolic steroids that mimic testosterone.
What are anabolic steroids? Medicines that are synthetic versions of testosterone are known as anabolic steroids. These substances are known by their technical name, anabolic androgenic steroids. Androgenic refers to a class of sex hormones known as androgens, while anabolic refers to the process of constructing tissue, mostly muscle. The primary androgen is testosterone. It encourages the growth of masculine traits. Men have naturally higher levels of testosterone than women do. The primary reason why doctors recommend anabolic steroids is to treat a male's low testosterone. However, it's also used for other illnesses. For example, it helps patients with autoimmune diseases and some types of cancer build their muscles.
Steroids have several legitimate medical uses. They are prescribed to treat conditions such as wasting diseases like AIDS, certain cancers, and severe muscle loss. In these cases, steroids can significantly improve quality of life and aid in recovery.
Anabolic steroids come in several different forms, including pills, injections, creams, or topical gels, skin patches, and implantable pellets. These compounds promote protein synthesis, essential for cell, tissue, and organ growth, including muscles. They also inhibit cortisol, a molecule that breaks down substances like protein.
Physical signs: rapid muscle growth, unusually fast increases in muscle mass, skin changes, acne, oily skin, and stretch marks, hair growth, increased body and facial hair in women, and male pattern baldness in men, voice changes, deepening of the voice in women, breast development, gynecomastia or breast growth in men, testicular shrinkage, reduced testicle size in men, menstrual irregularities, changes in menstrual cycles for women, liver damage, jaundice or other signs of liver issues, and cardiovascular issues, high blood pressure, and increased risk of heart disease.
Some of these psychological signs include the increased irritability and aggression, often referred to as roid rage. It also includes the severe mood swings, including manic or depressive episodes, and in extreme cases, the steroid abuse can lead to psychotic symptoms. Other behavioral signs include obsessive behavior, which is an obsession with body image and muscle size, secretive use, hiding steroid use or lying about it, or dependency, developing a tolerance and needing higher doses to achieve the same effects, leading to addiction. These signs can vary based on the individual's age, gender, and overall health condition. Long-term abuse can lead to severe health complications, including organ damage and increased risk of certain cancers.
Steroids enter cells and bind to androgen receptors, activating genes that increase protein synthesis and decrease protein breakdown. This process can lead to rapid muscle growth and reduced body fat percentage. However, these changes come at a cost, and the long-term health consequences can be severe.
Do you know the answer? What is the difference between typical lipids and steroids? 1. Lipids contain a carbon skeleton while steroids contain a hydrogen backbone. 2. Lipids contain fatty acid chains while steroids do not. The correct answer was 2. Steroids fall into the category of lipids but are not similar to your typical fatty acids lipids in structure, as they do not contain fatty acids. It's essential to weigh these factors carefully and make informed decisions. Always consult with a healthcare professional before considering steroid use.
In the world of sports and bodybuilding, steroids are used to enhance performance and physical appearance. And it can lead to rapid increases in muscle mass and strength by accelerating protein synthesis and reducing muscle breakdown.
Some studies suggest that Over 15% of athletes have used anabolic steroids to boost their performance. Some famous cases. Richard Piana was a bodybuilder who died at 46, 2 weeks after being put in a medically induced coma. He had a 27-year history of steroid use. He once said, "If you want to stay natural, stay natural. Steroids hurt your body, but if you want to be a pro bodybuilder, you probably have to use them." When he collapsed, police found 20 bottles of testosterone at his home. In bodybuilding, it's often believed that to win competitions and go pro, you need to use steroids and that natural results just don't compare.
About the East German women's swimming team in the 1970s and 80s. The East German government gave athletes performance-enhancing drugs to show off the superiority of communism. At the 1976 Montreal Olympics, the East German women's swim team won 11 out of 13 gold medals. Over 9,000 athletes were given these drugs. Competitors suspected doping, but the government covered it up. After German unification, some involved in doping were convicted, but the athletes suffered lifelong health issues. Heart disease, infertility, and cancer were some of the hidden costs. These stories show the severe impact of performance-enhancing drugs in sports. Now, let's watch a quick video that demonstrates what happens when you take steroids.
This episode is supported by Hims. With over 3 million Americans having used steroids, the desire to bulk up is strong. But what even happens to your body when you take steroids, and are there major risks to performance-enhancing drugs? Every time you pump a weight at the gym, your muscles experience damage, but the body recovers by forming new muscle protein strands to repair the muscle fibers. Over time, these strands increase in thickness and number, and ultimately, if muscle protein synthesis is greater than muscle protein breakdown, your muscles will grow. The degree of growth is largely regulated by testosterone, which increases protein synthesis. It's why, generally, men have larger muscle mass than women, as they have higher levels of testosterone. Now, steroids are any compound with a specific 4-carbon ring structure, so the term steroid actually includes some chemicals that can be used to treat fever and headaches, and even sex hormones like estrogen and testosterone. But the type of steroid we'll be looking at actually mimic natural testosterone with the intention to enhance performance, and are used by more than 15% of gym goers. Within a single day of taking steroids, the expression of your genes will begin to change. Steroids easily enter your cells and bind to the androgen receptor. At this point, they can move into the nucleus and attach to your DNA, which activates hundreds of genes to increase protein synthesis while slowing protein breakdown. In the end, people who take steroids can have 3 to 5 times more nuclei in some muscle cells. Steroids can also stop the differentiation of fat stem cells and decrease a person's body fat. Days in, and you're quickly increasing muscle size and strength while also protecting muscle fibers against damage, making steroids ideal for exercise tolerance and recovery as well. But continue to take them and your behavior may start to change. Because steroid receptors are found in parts of our central nervous system like the forebrain, hypothalamus, and pituitary gland, steroids can lead to the classic roid rage. A study of athletes taking steroids showed 20% developed higher manic and depressive scores than non-users. Mice given steroids over 10 weeks also become more aggressive towards other mice put in the same cages. Male mice also become more dominant and are more willing to compete for sex with female mice. But that sex drive may not translate to better sex. For female users, steroids can interfere with the estrous cycle and may decrease sexual drive. Masculinization can occur as well, with female users gaining deeper voices and starting to grow more body and facial hair. Male users may experience sperm cell abnormalities and decreased sperm count. Steroids also decrease natural production of hormones that are necessary for maintaining testicular size, meaning your balls will shrink. And since most steroid users follow a cycle of on and off dosing periods, natural levels of testosterone can be quite low at times, causing erectile dysfunction and decreased libido in males. 40% of male users also developed enlarged breast tissue as steroids break down into estradiol, which stimulates the growth of mammary tissue. Finally, steroids can cause a high level of acne in almost half of users and increase the risk of heart disease and stroke. So, yes, steroids will make you bulk up faster and improve your athletic ability, but as with most things, comes with a set of risks and side effects that you'll likely experience as well.
True or false? Steroids make muscles grow quickly by promoting protein synthesis and inhibiting cortisol. This is true. Steroids promote protein synthesis and inhibit cortisol, which leads to rapid muscle growth and strength.
True or false? Anabolic steroids can be prescribed for medical conditions like certain cancers and AIDS to help patients gain muscle mass and strength. The answer is true. Anabolic steroids are prescribed to treat medical conditions such as certain cancers and AIDS to help patients gain muscle mass and strength.
True or false? Steroids work by binding to androgen receptors and activating genes that increase protein synthesis and decrease protein breakdown. This is true. Steroids bind to androgen receptors, activating genes that increase protein synthesis and decrease protein breakdown, leading to muscle growth.
That is all. We hope you guys got a better understanding about the world of steroids. Thank you all for watching.